Hello. Menopause is just another chapter in the transition of our life. It is normal, natural, and not without benefits. There is freedom from periods, freedom from pregnancy, freedom from abortions, but not that it's smooth for everyone. The symptoms can range to fairly smallly bothersome to truly devastating to somebody. Here I am Dr. Shilpa, consultant gynecologist at Harley's Clinic, Mumbai. I am here to talk about one of the most controversial topic. Is HRT required? Do we need it? Should we start it? Would we get any side effect? When we talk about menopause, the transition, when it is not smooth, the lady faces a lot of vasomotor symptoms. Vasomotor symptoms are very disturbing. About 75% of ladies face it in their menopause. Here the lady feels that she becomes flushed, she becomes red, there is sweat which is coming and she feels breathless at times. The similar features which happens in the night, we call that as night sweat. It is particularly of disturbance because she feels there may be some cardiovascular problem, some sort of a heart problem to her, but is actually the vasomotor symptoms which is happening because of the menopause. The other disturbing thing that she faces in menopause is genito-urinary problems. When we talk about genito-urinary problems, it is the bladder, it is the vagina, both of them are affected. In the bladder, she feels that she has repeated urinary tract infections. Most of the time we are able to find out that there are infections, but in some times even the urine report mentions there is no infection, but the feeling is so intense, she feels the pain, she gets the feeling that she has to evacuate repeatedly, but hardly any problem is there otherwise when we see medically. The other thing would be the vagina. The vagina becomes dry. She is not able to have sexual intimacy properly. The vagina shrinks in size. The libido decreases for her. It can be because she mentally doesn't feel the need of it, and of course physically she is not as dry, as wet as she was earlier. The third most disturbing thing would be pain in the bones, pains in the joint. It happens because of the decreased calcium, again a part of the menopause. We usually do a test to find out whether it is osteopenia, which is decrease in calcium, or it is the calcium and the collagen again, which becomes a part of osteoporosis. Fourth thing that we see is changes in the skin. The skin becomes more wrinkly, there is loss of collagen, the acne which were not there is coming in a menopausal thing. So these are all the reasons where the lady can need an HRT. Now we get a lot of patients coming and asking whether the HRT is safe for them, whether they can get a breast cancer. The suspicion of breast cancer has been initiated because of a study that was conducted in 2002 talking about Women Health Initiative. That was the name of the study. They have used different type of hormones, different estrogens, different progesterone, and it has raised certain eyebrows that time as well, whether it can increase the chance of breast cancer or that can increase the chance of cardiovascular disease. Now this study was conducted some 20 years back. Nowadays we use different type of hormones which are FDA approved. We are very bioidentical molecules. They matches more towards the body hormones. These are not the same synthetic progesterone that we used to do then. Now we used micronized progesterone, so it's a different HRT that we use now. According to the evidence, the chances of having a breast cancer with the HRT that I just told you has come to be statistically insignificant. The significance, if we want to match, would almost be similar to a lady having 5 glasses of wine per week. Those have higher chances to have a breast cancer rather than having an HRT. Now HRT when we give, we choose which way. We choose according to the patient preference, we choose according to how the medically she is fit. They can be given orally, they can be given through transdermal route. If we give through the transdermal route, it bypasses the liver and increases the efficacy, also decreases the side effect of the HRT. There are some people who are a good candidate for vaginal HRT, in which we give the cream because the genitourinary symptoms are more profound for them. If I talk about the side effect now, we can divide the side effects into short term. In the short term, usually how a lady when she menstruates, she has PMS type of symptoms, she can get similar to those. There can be breast tenderness, soreness, there can be some cramps in the tummy because of the hormones working on it. But these are of little significance. Usually as you keep on taking the HRT, usually in 3 to 6 months time they improve. The other features is that the patient, if she has followed with any type of an abnormal bleeding during this HRT, of course necessary investigations in the meantime have to happen. Now when I talk about the long term side effect of HRT, long term the incidence is low, but we do talk to lady about what care she has to make. The lifestyle correction has to be really nice. The chances of thromboembolic episodes, the incidence has increased. So taking care of your diet, not indulging into alcohol, leaving smoking, all those things are generally good, and also would be very good if the person is an HRT. The HRT is something that the lady would choose because the way she wants to age is totally as she wants. We cannot generalize a picture that she has to accept the way she is or she is going to be. It is solely on the choice how the lady makes. I believe all women deserve to get the proper counseling. They should decide what's best for them rather than us generalizing that this is how every woman should age. It is really the choice of the lady how she see herself 5 years down the line. So visit your gynecologist for the proper advice. If you have any doubts about HRT, please feel free to share it with me in the comments below. Also you can reach out via contact details given in the screen. Before you go, do subscribe my channel, hit the bell icon and select all to receive the notification for more such videos. Thank you so much.